welcome to Elite MD. Today we're going to be doing a little something different. You have seen our education series, you have seen our behind the scenes, you've seen behind the scenes of our training, and today we're going to put these two on the hot seat and we're going to be answering your questions. But before that, let's get, even though they don't need any introduction, let's introduce Dr. Sonia.
Hey guys, here Dr. Sonia here at Elite MD. I'm board certified dermatologist as well as co-founder and medical director at Elite MD. We are so excited to be celebrating our 10-year anniversary this year, and we're super excited to be having serviced about 40,000 patients from all over the world, from 6 continents, 25 countries. So, we really believe in innovation and education, and we just hope that we can continue to give you all of that in our years to come.
And this is Rikki Rodriguez, our certified board nurse practitioner.
Hi, I'm Rikki Rodriguez. I'm board certified nurse practitioner here at Elite MD. I work in all aspects of the practice, so dermatology, laser, and the plastic surgery areas. I do a lot of injectables as well as assist in office and general surgeries.
And today we're going to be asking these two a bunch of questions. They don't know what's coming at them. It's going to be totally unscripted. We're getting a lot of these questions from you guys, our patients, our followers, our audience. So let's get right to it.
All right.
One of our first questions is, people will go to great lengths for beauty nowadays. So I kind of want to ask both of you. You guys do a lot of continuing education. You guys see a lot of patients. You see a lot of botched jobs. What's the most alarming trend that you've seen people come in with that you're just like, I wish I could tell the entire industry, stop doing this or what have you. What's something that's really alarming for you?
There's so many things that do actually come to mind because we are actually a center that sees a lot of complications. A third of patients that we actually see in our centers end up being sort of botched jobs or side effects or complications from other places. Unfortunately, I think that the education is not, and the background homework is not being done appropriately because sometimes people just don't know what to look for. A lot of people do look at budget, which is, I completely understand why, but at the same time, when you're trying to look and compare for lower price, you're also going to be affecting your long-term outcome. So people go overseas to get procedures done. People go, and overseas there's nothing regulated, and they're getting it done in like the back alley and like salons and really non-physicians where they're getting complications, side effects, infections, and we're having to deal with some of those complications, which are very difficult to treat after the fact. So that's one really important thing, is to make sure that you're doing your homework and your research, and don't go based on price. You want to go based on comfort level, your homework, your background knowledge. Look for a board certified dermatologist, plastic surgeon who's supervising the practice, and so that way that you'll be in good hands. And I always say, go meet several different doctors and make sure that you feel trusted and you have that connection, and make sure that you ask the right questions. So ask about their training, ask about their education, ask about their experience. We've done thousands of procedures here, and we do everything aesthetics, but I'm not going to be the one to deliver a baby. Like if you're pregnant, I can deliver a baby, but you don't want me doing it. You want to go to the experts who's delivering thousands of babies a year. So I think that's really important. And then also in skin of color patients, I think people go to really great lengths looking at what the beauty trends are and the fads are. And, it's interesting because I'll have that contrast. Well, I'll have a Caucasian patient who says, I want to be like you. I want to be tan like you. What can you do for me? And then the next patient is my skin of color patient. They'll say, I want to be Caucasian. I want to be fair skinned. How fair can you make me? So they're going through great lengths to actually change the color of their skin. And so they'll go to, again, overseas markets, internet, and they'll buy things that are not regulated or FDA approved. And these, chemicals have other harmful things in them. And again, they're applying these formulas that are not FDA regulated, and then we see issues with excessive hyperpigmentation, or what we call ochronosis, or mercury toxicity, right, and atrophy, right, from steroid use. And people don't know what they're putting on their face. And again, very difficult to be able to treat those complications once they happen.
some of them are permanent.
Yeah. What about you,
Yes,
Rikki?
yeah.
What have you seen?
Well, to add on to Dr. Sonia with plastic surgery, I'm definitely considering post-op care. When you go somewhere far away, you may not have the access to regular post-op care that you
right.
need to heal appropriately. As Dr. Bansal's assistant, I see so many of the post-op patients, and it's seriously so important to me to make sure everything is going along and check in with them, see them as much as I need until they're properly healed. Some people don't need to come in that often, but let's say you're someone who gets a complication, it's going to be so important for you to, have someone to take care of you. If you go have surgery somewhere far away or out of the country, you have to find somebody who's going to accept all that responsibility.
Yeah, it's not just about doing the cutting; it's about the follow-up care that's also needed. It's
That's
just as
so
important,
much of a part.
right?
Yeah, so much.
What do you think are the top 3 most botched jobs you've seen walk in through the door? Top 3.
Tummy tuck.
Okay.
Breast.
Okay.
Very,
Wow.
very much breast.
Okay.
And liposuction.
Wow.
And I'm going to add on to that with lasers because, again, skin color and not knowing the education of what's safe for my skin and not going to the right place, or the experienced provider that understands skin of color and safety of lasers. So they'll go into, again, places that are not experienced or are not getting the right laser treatment. And then that's when they get the hyperpigmentation that could be a lot more permanent.
Definitely.
Yeah, not fixable.
With the other thing with injectables too, the trend that I see that's kind of frightening is too much at one time or too much too quickly.
Okay.
Sometimes like a
You're
trend
talking
right now.
fillers.
I'm talking fillers,
Okay.
yes, mostly. But right now there's a huge trend for big pouty Kylie lips. And so if someone comes in with very petite lips or something that's very small, you need time to build and stretch that.
And they
skin.
want to go from 0 to 10, like
Yeah,
in one sitting.
exactly. You're not
Okay.
going to go from a couch potato to a marathon runner.
Right.
You need time to kind of build that
Right.
up and then listen to your provider and work together and come to your follow-ups.
On that note, say someone comes in with really thin lips and they're like, we want Kylie lips. Would you say that that's maybe like a 3-step process, or what would you tell a person that wants it today?
I would tell them that it's going to be a process and
Okay.
it's going to take probably months to
Okay.
get there.
Okay.
But I do like to have more of a natural look for my clients that are walking around too,
Right.
because my name is also part of
Yeah,
them.
exactly.
It's like, oh, where did you get your lips done? If it looks scary.
And there's really an art,
Yes.
It really is an art when we're looking at the lip shape, the volume, we're looking at in comparison to the proportion of their entire face, their body. We want things to match. So somebody who comes in saying that, Angelina Jolie lips or Kylie lips, but they've got the thinnest lips, well, we're not going to have that stark contrast. We're going to say, yes, we can give you the Angelina Jolie lips. We're going to actually have a conversation about, let's get on the same page on what is going to look beautiful on you and the natural beauty of your features rather than trying to imitate, a celebrity that's out there. So we like to go for the natural. We like to go to accentuate your natural beauty and your features. We don't want to change your look. We just want to help you feel the best that you can, at the age that you're at, the best version of you. And the other thing I should say is even with the fillers, you have to be careful because there's probably about a dozen FDA-approved fillers here in the market. Unfortunately, there are practices even here in the States that will get sort of bootleg ones that you can get on the internet or overseas, and even Botox is one of those. And they're a lot less expensive, but unfortunately, they're also not FDA regulated. So you could be getting injected by something that is not actually FDA approved. And then what goes on with that could be other complications and side effects that are not well studied.
One of our next questions also comes from a potential patient, and they've asked, do you feel as healthcare providers, doctors and nurses, that women know women's body better? I think they're trying to figure out if they would like to go with a male practitioner or a female practitioner. And I think there's a big debate on, what's best for women.
Yeah, I think that that's always a personal choice in terms of who you decide you want to go for. It's not necessarily just going to be a male versus female, but it really is going to be building a trust and connection with whoever it is that you're going to choose. But ultimately, I definitely have the feedback from females that they feel more comfortable with a female because we can understand the journey of a woman and the aging process and the aesthetics and what are the beauty trends and what are, I think that we have that connection of relatability. Not to say our males are not just as good. They're great as well, but we understand a different dimension of a woman and their journey. And then I can speak as, as a mom. I couldn't speak of it before, but if I have another mom that's coming in who's had kids and I've had kids, we're sharing our experiences of that, and then what sort of happened to our bodies and what are some solutions to that. So I can definitely kind of get in their shoes a lot easier than maybe a male, surgeon can, or a male dermatologist can. So I think that the comfort level is the most important thing that you can, go into before you choose the provider that you actually want to work with.
And how about you, Rikki? Would you say that if you were getting anything done, would you prefer a woman practitioner?
I would also agree with Dr. Sonia that it definitely depends on just who you're most comfortable with. And then like doing the research, which Dr. Sonia just previously talked about, going to somebody who specializes in what they do, because then they're going to be more familiar with that rather than something they do once a month or once every 3 months. I think being in that specialty is so important. And whoever makes you most comfortable, because you're going to see them all the time, and you just have to be on the same page as them, or else it's not gonna. It's gonna be not great. Yeah.
And we can talk a lot more girl talk with our women too, like the makeup you use and what your clothing, and so it makes it fun that way too.
Yeah, I agree. We'll put you on the spot. What have you done? And or what's next for you? So
I'm actually 90 years old. But let me tell you, I think it's really important as providers that we actually try our own treatments. So I think it's important to, if we're going to talk about something, it's again relatable when we've actually had the procedure ourselves. Right. So I've certainly tried. I mean, I've had access, of course, to the best of the best. Unfortunately, I didn't have always the time to be able to try every single thing. But I have ventured into all the neurotoxins I've tried, which is the Botox and Dysports and Xeomin, as well as a variety of different fillers for a variety of different things. I think the new trend right now is really the contoured cheeks and the jawline, and I love that. So, I've had that, the lips done as well. Actually, Rikki did them. So she did a great job. And then I think that also with the lasers, there's so many lasers out there that do a lot of preventative work, and the prevention is really important for me because I know when I hear a patient saying, I see where my mom is, and I want to try to avoid some of those things. What can I do? So I started looking at my mom and saying, well, I should probably do X, Y, and Z so I can prevent some of the issues that my mother is having. That entails some of the fillers. Lasers are really great. I think laser hair removal has changed my life. Literally, it's been life-changing where I don't have to shave every day. I'm shaving like once every quarter, I'd say 3-4 months, which is amazing. So when I'm wearing this dress, I don't have to worry like, oh, did I shave my, no, I'm good. So that's been life-changing for me. And then, being a mom, I can understand now the body has changed and shifted a little bit. So I was one of those that thought, oh, I won't ever be getting this done. But then when you become a mom and you start the aging process even more, you can, I might want to consider maybe some body contouring procedures. I've had cool sculpting done, which is very simple and easy, and that you can actually check out on my Instagram page.
We did a Facebook Live session.
We did do a Facebook Live session of me having it done with my acai bowl and sitting there eating, and I'm getting my cool sculpting love handles done.
She did it all during her lunch hour.
I did. And I'm the baby, and if I can handle it, then I can easily talk about it with my patients. So yeah, I've had a variety of things done. I think it's important to try it so you can feel better about talking about it and you're more relatable, but there's definitely other things that I may venture into.
Nice. Rikki, would you like to share?
Well, I do a lot of injectables at LEMD, and I enjoy injectables for myself. So I do use Botox regularly, and other neurotoxins I've tried as well. I use filler on a regular schedule just to maintain volume and make sure that everything kind of stays where it is. I also love laser hair removal. I've done cool sculpting. What you're saying, I'm not a mom, but eventually, one day if I am, I will definitely do all the lifts. And, so I can definitely say that I would be on board with that.
Awesome.
And I've definitely noticed there's a generational phase, right? Like you're in your 20s and you're like, I don't really need any of this stuff, and you think you're going to have this body in the face forever and ever. And then you kind of get into your 30s and you're kind of figuring things out at that time, feeling a little bit more solid about who you are. And then for me, that's when I had my kids. And then you get into 40s and it's like, whoa, wait, something's going on here, right? Like the gravity starts kicking in and you start noticing the changes. And I was one that like, I could just not eat for a couple of days and be like back. And now it's hormonal, definitely a lot harder. There's a lot more, stuff on my plate. So there's stress fat. So, all that stubborn fat is difficult to lose on your own. So the generational, 20s, 30s, and 40s, you kind of go through different phases too. So.
Well, thank you, girls, for sharing what you've done. But let's talk about any new things you've seen that you're really interested in trying.
I just came back from the Academy meeting, which is our big American Academy of Dermatology with 20,000 dermatologists there. We really got the best of the best at our fingertips. And educationally, we learn a lot from each other. So one of the areas which I did post on our Instagram page were some of the new learnings that I was going through. And one of them was PRP. Platelet-rich plasma, which is a type of a treatment that we're doing actually down in LA with our partners who's doing regenerative medicine. And it's been shown to actually help heal multiple different conditions and orthopedic conditions, sports injuries, pain, back pain, things like that. But what's really cool is it can also go into the dermatology and plastic surgery world where we can actually help the stem cells using your own blood, your own platelets, your own plasma to regenerate your own skin cells. And it also can regenerate your own hair that has been lost through time. So for people who've got male pattern thinning, female pattern thinning, we can actually regrow hair using your own blood, which is kind of cool.
I'd like to sign up for the PRP.
Yeah, I know. I am too.
What about you, Rikki?
Let's see. What was the question again? Sorry, I got so involved in the
I'm sorry, what's next for you? Is there any like new treatment or new procedure that you've heard about or that we're offering that you're like, okay, that's next on my list?
I have a lot of fun with injectables. I just think it's really an art form and really a great way that someone can walk in and walk out with a difference that they can see and feel better about in a couple of days after some swelling has gone down, if they do have any of that.
And you did a great job the other day with our jawline contouring, which is really cool.
That's what I was going to talk about.
Yeah.
Which is very popular now.
Yes, very popular. So that's what I would want to do next too. But definitely more jawlines, contouring, separating the face from the neck area, and maybe adding a little lip plump. I love doing lips too. That's my favorite.
That wraps it up for us today. If you want to submit any of your questions for either Rikki or Dr. Sonia, please DM us on Instagram or Facebook, and it's at EliteMDSpa. Or visit us on our website at elitemdspa.com. And that's it for us.